Hello, I am here today with Dr. Judith Boice. This is a very special treat. She is a naturopathic physician and acupuncturist. She is a best-selling author with her great book, The Green Medicine Chest, which is all about how to use plant medicine at home safely with your family. And she is a best-selling author of other books as well and an award-winning teacher. And I really appreciate you being here today. We are going to talk, I hope, about aromatherapy. I am so interested to know about how we can use aromatherapy to help manage anxiety, help us when we are just feeling that overwhelm. And I can't wait to ask you some questions about that.
Wonderful. Thank you so much for the invitation.
Oh, I'm so glad you're here. The first thing I'm kind of curious about is, can you just tell us what aromatherapy is? What do we need to know about that?
Yes, aromatherapy is technically it's the inhalation of usually essential oils, but some people actually they define aromatherapy more broadly. As an example, I had one colleague who worked with aromatherapy in hospice, and she was working with someone who had been an auto mechanic, and he loved the smell of gasoline. The smell of gasoline was just so calming to him. So she quietly sneaked into the hospital at one point, and she put 1 or 2 drops of gasoline on a Kleenex folded up in her pocket, and she very quietly laid it on his shoulder so that he could smell the smell of gasoline. So aromatherapy, usually the way we use it now is using essential oils, but keep in mind it's any scent, any smell. And what's amazing about aromatherapy is when we inhale those substances, especially essential oils, we actually begin to have immediate absorption. It affects the brainstem and our central nervous system right away within seconds. And it also crosses our lungs and into the bloodstream so that we have systemic effects very quickly just from breathing in the essential oils.
Amazing.
I
hope, well, just amazing how fast it is that it's inhaled and just by smelling something. And of course, we know that the sense of smell is so primitive also, and the mechanic and gasoline smell is so interesting because our associations for smell is deep in our brain lodged. So I imagine that they're very individual kinds of experiences with smells, but then there are probably some general ones too. And that's what we're going to talk about, I hope, is what are some general calming smells that most of us tend to like or are worth trying out if we're curious.
Absolutely. And let me just preface this also by saying, I'll be sharing with you some of the therapeutic effects of the essential oils. And the truth is, your experiences and the things that have happened to you around those scents in some ways trump the therapeutic action. So for example, if you had a family member whom you really didn't like, or they were mean to you and you associated them with a certain scent, that essential oil is probably not going to be the one that you choose. Right. So I'll share with you some of the therapeutic indications, but keep in mind, the best scent is the one that you enjoy. So of the 4 that we'll talk about for anxiety, ideally you would choose the one that you enjoy the most. And we'll also probably touch briefly on rotating them also, not to keep using the same oil over and over. So one that is probably the best known and also has lots of research behind it is bergamot. Bergamot is Citrus aurantium variant bergamia. That's a mouthful.
I'm impressed. It's a long name.
And bergamot, they've actually found in some research studies, is as effective as benzodiazepines in reducing anxiety, but without the sedating effects of the benzodiazepines. And they found in research there's a different mechanism. It's not the same mechanism that causes the calming, but it has similar effects as the benzodiazepines. So
fascinating.
Isn't that amazing? And the bergamot, they've done human studies, they've done animal studies, that it can not only help calm anxiety, but it also uplift mood. And almost all of the citrus essential oils have that mood uplifting quality. They found also that another physical marker we've discovered is that it will reduce cortisol levels. And cortisol levels, when they're elevated, are associated with being on red alert, that fight or flight response.
Right.
So bergamot, they found, even within 15 minutes, will help bring down the cortisol levels in saliva.
That's so important
amazing.
when it comes to anxiety, because cortisol is sometimes the last thing to come down, and being able to help get it down, at least to rest before it kicks back up again. So helpful.
Exactly.
Mm-hmm.
Yes.
Mm-hmm.
So bergamot is one of the shining lights for
Okay.
working with anxiety. Another is lavender, and most people are, if they're familiar with essential oils at all, they've probably experienced lavender.
Yes.
Lavender, they found lavender has calming effects. It has anxiety reducing effects. It also has a lot of other things that we don't think of with anxiety, like antibacterial and antiviral effects. But the other one that has had specific research behind it is improving sleep. And they've done research studies where they had one group who did all the good sleep hygiene things that you're supposed to do, going to bed at the same time and avoiding screen time and avoiding caffeine. And another group did all of those things, and they inhaled lavender essential oil before going to sleep. And they tended to have deeper and longer sleep compared to the group, even the group that was doing all the right things for sleep.
Wow.
The lavender gave another edge, another support for improving sleep.
Fantastic. So it could be quite a tool at night, especially.
It's been even found in the face of something like open heart surgery. There have been 3 different research studies done where they gave lavender essential oil, and in the study, they just had the person smell a cotton ball with a couple of drops of lavender essential oil for 20 minutes twice a day.
Wow.
And that was enough to reduce anxiety. And when it was used for several days in a row, like 10 days or more in a row, it also helped improve sleep. So remember that you get an immediate effect with essential oils, but also there's a cumulative effect using them over time. I'll say more about that in just a moment.
That's helpful.
Cilantro is another one that is high in linalool, and linalool is also high in lavender. And they both have that calming, anxiety reducing effect. So if coriander appeals to you more than the lavender, that would be another good essential oil to work with.
Okay.
And finally, geranium essential oil, and actually I happen to have this sitting here. I don't know how well you can see that. Geranium essential oil.
Like the flower, like the geranium flower.
Right, like the one that grew on your grandma's front porch, right? Geranium has a wonderful rosy quality to it. And there was also a post-surgery study done with geranium, and they found that geranium had a very stress-reducing, calming effect on people, even after something as serious as surgery. So keep in mind that even in pretty advanced stress-inducing situations, the essential oils can have an impact. And the last study I'll mention is, I've done a lot of work with cancer patients, and there was a research study done in England, and they used inhalers. And I'll just briefly describe what the inhaler looks like. If you're familiar with the old Vicks Vapor Rub inhalers, you can get inhalers in the health food store now that are blank inhalers. And they have a tube, like an outer sleeve, and then another tube that fits inside that you can screw shut. And the end of the part that you screw has a plug at the end, and there's a cotton wick that's about this long, and you saturate the cotton wick with about 8 to 10 drops of the essential oil. You put it inside the tube, put the plug on at the end, and then insert it into the sleeve, so that you can expose just yourself to the essential oil, which is hard. Like if you're in a public place, you're at an office, people may say, oh, I don't want you, don't get that essential oil stuff around me. So with using the inhaler, you can just expose yourself to the essential oil. So in this particular study, they used the inhaler in a hospital setting because they didn't want to expose everyone to the essential oils. And what they found in this particular study was that the more frequently someone used their inhaler, the better the results from using the inhaler. So like if someone they kind of waved the inhaler under their nose for a second or two, once or twice a day, they didn't have that much effect from it. But
Okay.
if you're sitting, like you're sitting and reading, or you're doing something online and you've got the inhaler sitting here and you're just breathing normally and you leave it there for 5 or 10 minutes at a time, and maybe you do that every few hours, you have a much stronger effect from
Okay.
the
So
essential
5 or 10 minutes, you'd say, of the breathing, whether it's with your inhaler or even you said on a cotton ball, which sounded really simple. I heard that. There's
Yes,
nothing you have to buy to have a cotton ball and just have it
right.
near you. And of course, they're the diffusers that are in a whole room, but those are not private. Um,
Yes. And the diffusers, I actually have one here that's kind of a little bit fancier, dancier one. Oh, it's not going to come all the way over. The diffusers, they are a way that you can diffuse the whole room. You can cause the essential oil to fill the whole room. Ideally, though, you don't run it continuously for hours at a time,
mhm.
because the essential oils are really powerful. If you don't remember anything else from our time, I'd encourage you to remember 1 drop of an essential oil is roughly equivalent to 30 cups of tea.
Wow.
30,
One drop.
30,
One.
one drop. One
Okay.
drop is roughly equivalent in strength to 30 cups of tea. So these are incredibly potent. So 1 drop will go a long, long way.
So one
So,
drop on a cotton ball, 1 drop on, well, you said 8 drops in the diffuser.
right. And that inhaler, the inhaler that has the 8 to
I'm
10
sorry,
drops,
the inhaler. Yes.
yeah,
Mhm.
that'll last for 2 to 3 months.
Oh, I see. That's important that we got to this. And so it
Yeah,
preserves the oil probably because of its containment, unlike
right.
a cotton ball. Mhm.
Right, because remember, essential oils are volatile oils. So if you leave them out in the open, they disperse in the air. But if you
Okay.
keep them inside a container, then they'll last for a longer period of time.
Okay. Well, and that was
So
an awfully small bottle you had. Very small
yes,
bottle,
so
but there's a lot
yeah,
in there, right? If you're a drop at a
exactly.
time. Hmm.
If you're using a drop at a time, this might last you for months.
Okay.
Yeah.
Can you ever put it directly on your skin?
That's an excellent
Oh,
question,
sorry.
because
I wasn't sure you were going to get
no,
there.
no, it's a great question. No, you can use the essential oils directly on your skin. And actually, when you apply to the skin, you're getting 2 things. You're going to get absorption through the skin into the bloodstream, and you're also going to be getting the inhalation exposure. So you're going to get a double whammy,
Hmm.
really strong exposure. And in most plants, and like if you went to a geranium, the actual plant growing,
Hmm.
usually a plant is 1 to 2% essential oils, like the total plant volume is 1 to 2%. And you want to dilute the essential oils back to that dilution to put them on your skin. So a
Okay.
simple memory tool is 1 teaspoon of a carrier oil, like let's say almond oil or sunflower oil, vegetable oil. 1 teaspoon of a vegetable oil, 1 drop of the essential oil is a 1% dilution. 1 teaspoon, 1 drop, 1%. So
Okay.
if you were gonna put essential oils on, like you wanted to put some on your wrist, or
Hmm.
you wanted to put some on after a bath or a shower,
Hmm.
dilute the essential oil and the vegetable oil and then rub it on your body instead of putting the essential oil directly on your skin.
Okay. All right. Mistake I've already made is
Yeah,
not to
and
dilute it. And when you said dilute it, I might have thought I'm going to dilute it in water, but no, not
right,
water, in oil.
right, because they're oily substances, and it's
Mhm.
literally mixing oil and water. And I have to say too, Dr. Clark, when I first started working with essential oils, I did everything wrong. So that's part of why I'm so good at helping people know how to use them.
Well,
I
it's
did
good because
everything wrong.
it's more complicated than it sounds. One little bottle, what do you do with it, right?
Right.
Yeah, and
Um,
knowing the dosing and how to use it is, I think, so important so you
it
can get the
is.
benefit.
Absolutely. So you want the benefit without overusing it. A
Hmm.
lot of people think also, well, something's only going to be helpful if I take it by mouth. But keep in mind that when we take anything by mouth, food, herb, essential oil, it crosses to the liver and the liver breaks it down. And it's actually, the essential oils are very hard on the liver.
Mm.
It's a lot of work for the liver to break down the essential oils. So you can actually get as strong and sometimes stronger an impact by inhaling or rubbing on the skin. I am going to contradict myself though and say there is one oral form of essential oil, lavender oral form, which is called Selexin, that has been found to be more helpful for chronic anxiety when it was taken orally than to just use the inhalation. So that's the one exception, I would say, for anxiety. In general, you're going to get plenty of activity, a lot of strong activity in reducing anxiety just by inhaling the essential oils. And if you're someone who's working with chronic anxiety, you might want to talk to your naturopathic physician or someone who's trained in plant medicines about using Selexin, which is an oral form of the lavender.
Okay. All right. That's good to know. So just in summary of how to use them, we've got all these different ways depending on how private we want our experience to be. The diffusing, the inhaling, on the cotton ball on our skin. Being aware of how potent they are sounds really important, especially when we apply them directly. And then just to review the dosing, would you say with inhaling, it's by minutes, it's by breaths, it's per times a day at different times a day? Are there any recommendations around dosing and times of day?
Yeah, excellent question. For skin applications, I usually recommend 3 or 4 times a day at most, like at least once or twice, maximum 4 times a day. For the inhalation, if you are actually able to sit with the inhaler, like 20 minutes, 2 or 3 times a day is the most that you want to use. But if you're you're just about to stand up and give a talk and you're really anxious, go ahead and take 3 or 4 deep inhalations of the essential oil right there. Get out your inhaler or your cotton ball, take a few deep breaths right there. You don't have to have it for a full 5 minutes to have some effect.
Okay.
So you probably would go for 20 minutes twice a day or several of the shorter exposures through the day with the inhaler. For the diffuser, usually it's, if you want to use it hourly, like 5 minutes every hour to have the diffuser on, or think about having the diffuser on for an hour and off for 3 or 4 hours. On for an hour, off for 3 or 4 hours.
Okay.
Like I mentioned earlier, it's hard on the liver to have a continuous exposure, even inhalation exposure to the essential oils.
Well, and how long should we consider a course of treatment, if you will? Should we do this for when can we expect to feel results or feel help? And you said about choosing the ones you like. How should we test them?
Right, so part of it is just, and excuse me, that's my mindfulness bell, comes on every hour. That one simple way is to open the bottle and actually inhale, and then sit back and close your eyes and just notice your responses. And like I mentioned, there's certain things that we know therapeutically about these essential oils, but you may have your own deep
associations to them.
And you might smell it and think, oh, that reminds me of my favorite grandmother, and it's the perfect oil for you. Or you may smell it and think of, oh my gosh, that reminds me of my brother when we were small. I don't want that. So
trust yourself.
Trust yourself, notice your body sensations as you inhale. Give yourself, some people notice results immediately because it is entering the bloodstream immediately. It is affecting the brainstem immediately. If you've had a long-term chronic, deeply seated issue, you're probably going to be working with the essential oils for a few weeks at least before you decide for certain whether or not it's helpful. And my bias is for the majority of the essential oils, you shift the essential oil you're using every 2 weeks. And the reason for that is that if you overuse an essential oil, and I'll give you an example of that in just a moment. If you overuse an essential oil, your body can become sensitized to that essential oil and sometimes to the entire class of essential oils. And then you've lost them as a healing ally. So for example, of the 4, maybe you discover you love bergamot and you love lavender. And those are the 2 that you rotate every 2 weeks. So have at least 2 that you rotate between, or maybe you discover you love geranium as well. So you rotate the 3 of them every 2 weeks.
But you wouldn't do, I'm sorry.
No,
You
go
wouldn't
ahead.
do lavender in the morning and bergamot at night. You would do one course for your time period and let that one essential oil do work its magic rather than mixing them.
This is straying into the territory where ideally you'd start working with a certified aromatherapist, not a multi-level marketing person, but a actual certified. There is national certification for aromatherapists.
Mm-hmm. Mm-hmm.
And someone who's very skillful with working with the essential oils might have you inhaling one in the morning, one in the evening. Like, for example, there's certain essential oils that work with anxiety that are also more mood stimulating and uplifting, and you'd want to do those more in the morning.
Right.
But you might have a morning evening combination you do for 2 weeks, and then another morning evening combination you do for 2 weeks, and then you go back to the first. Having said that, also to contradict myself, is that we also are discovering that essential oils and blends have synergistic activities. So if you put 2 or 3 essential oils together, it's not 1 + 1 + 1. It's more like 1 + 1 + 1 = 10. There's a synergistic effect from putting them together. And that's where an aromatherapist can help really fine-tune, dial in specifically for you which essential oils would be best in the blending.
And I like that you said a physician or somebody who really has solid training in this and isn't just selling the oils, because these are powerful substances. And I can say for mental health, you may think you're only anxious and want a boost of energy. Who doesn't want a boost of energy? But maybe you've got an underlying mental health concern for which that would be the absolute wrong approach. Or perhaps you're already taking medication and you're using this as a boost. So I think being very cautious, not overdoing your exposure, picking one at a time sounds like the way to start.
Yes.
And if you have any questions or concerns, that you look for a certified aromatherapist. Is there some credentialing body or an online tool that you know of that you'd recommend for people to find folks near them, or even digitally or distance, that they could access?
There's a national organization called NAHA, and of course I'm just realizing as I'm saying it, it's the National Aromatherapy, and I forget if H stands for Herbal or Health Association.
Okay. But
NAHA.
NAHA. Okay.
NAHA. They're one of the national certification bodies, and there's also an aromatherapy council, International Aromatherapy Council, that you can look up.
Okay.
That is an international certification for aromatherapists. And these are people who've learned the science of the essential oils, and they've also had the practical experience for knowing how to work with essential oils to really get maximum benefit from working with them.
And I think when you're using it for to help a symptom that already could be serious, that you want to entrust your treatment to somebody who is experienced and well trained, and that's important. And it's not always easy to know what are the credentialing bodies and who can you trust. So thank you for that.
You're welcome. And just to say too, they're just extraordinary allies. And the last thing I'd mention too, as you're looking for essential oils, also look for organic. I don't know if you can see that. That one says organic.
Yes.
Because the pesticides and insecticides that are sprayed on plants are the same molecular size as the essential oil, and they'll move right along with the essential oil in the distillation process. So it's really important to look for organic.
Thank you. Thank you, Dr. Boice. I can't tell you how much I am learning from you. I am so enjoying I'm waiting for your book, because your book is between publications right now, but I think I'll get it any day. I've really been enjoying your online tools. I've learned there's so much that you offer that I have to listen, pause, take notes, go back, listen again. There's just so much to learn. So I just so appreciate the time that you're spending here to educate about aromatherapy for anxiety. And if people want to know more about you or your book, where can they go?
One of the easiest places to get a hold of the book at a wonderful, actually discounted price, is to go to greenmedicineacademy.com/book. So
Okay,
greenmedicineacademy.com
greenmedicineacademy.com.
/book, and you can get a hold of the book that way.
It's wonderful. And so are you. Thank you so much for this.
Thank you for the invitation. It's been a delight to talk with you.
I can't wait to put this up for people to learn about it. Thanks.